I think it's very important that Max Baucus lose in his next primary. He is the emblem of what's wrong with the Democratic Party of a modern era, which is totally taken over by big money. There's very little difference. I wasn't a Nader guy, but this latest thing with healthcare really kind of, oh, well, yeah, he was right. I think something that that we can exploit is that there is somewhat, and this is going to sound crazy, but not all these teabaggers are blindly railing against big government. A lot of them really have a problem with corporate power and the fact that the Republican Party is in league with corporate power and the Democratic Party is in league with corporate power. If progressive anti-corporate Democrats could somehow join forces with the disaffected people on the right on that anti-corporate message, I think that dovetails very nicely with single payer, because single payer is anti-corporate health care, at least from the perspective of funding. So we shouldn't necessarily assume that the teabaggers are our enemies, because the ones on the TV are the ones talking about big government. And the rank and file, they're much more about anti-corporate power and anti-fascism being like the merger of state and corporate power. But as far as the Democratic Party, I would love to see Max Baucus brought down.
Unfortunately, I think it's 2016.
Public president of PNHP. The steelworkers just got together a web-based strategy of putting together 6 unemployed people in each zip code, my question, so that they can push for job-related legislation and policies. My question is, what might be some of web-based strategies that we could use? And I guess the question is predominantly to Chris, but anyone else on the panel, that would foster a deeper grassroots organizing, which has to be done. When I was demonstrating in Grand Central Station, a couple of people came over with a big sign, Medicare for All. A couple of people came over and said, "What's Medicare for All?" So what we think is instantly understandable is not necessarily understandable. Of course, if you explain it, it's easier to explain that way. But obviously, we've got to get the message out on a broader grassroots basis in order to support things like third parties and knocking off Baucus and getting our teabaggers to join us.
I think the first thing that we need to do is have a series of 5-minute videos that explain Medicare for All very, very quickly, and another to explain how money in politics is what preordained the result in 2009. I mean, everyone knew what was going to happen, and it's what happened. I mean, the Baucus was going to be the most right-wing, and all of it was a big song and dance, because Baucus was going to get what he wanted, and then the Senate was going to get what they wanted. Now they're saying that the House bill has to be exactly like the Senate bill because of Massachusetts. So why are we even playing this game? Why don't we just let but as far as web things, I know that Katie, it's a goal for Healthcare Now, that they have some web tools that they're going to build out so that local groups can use. Maybe she can talk about that.
Well, in talking with activists around the country who start these local coalitions and do amazing work, something that we're noticing is that there's not a real sustainable database effort with local coalitions. Like, it's surprisingly boring to talk about, but so important in our organizing is being able to get data from people in the community, understand what districts they live in, and then be able to organize accordingly. So in New York, we try to make, especially around all the town hall meetings in August, Healthcare Now's database is set up so that we can go search by district, congressional district. So we were sending emails to people in each district saying, these are events going on in your area, get out there and organize. So that's happening on a fairly unsophisticated level right now, but we're looking, switching tools so that we're going to be able to help local coalitions build stronger databases, which helps to have stronger organizing and turnout.
We're going to take just 3 more questions. So we've got one over here, one here, and Sid. Did you change your mind?
Oh, I'm sorry. Was I the one over here? Just a quick, sorry, Martha Livingston. Just a quick comment to Chris, and that is the real difficulty in organizing. I don't mean to sound downbeat, because organizing is my life, but the difficulty in organizing of saying, Congress is bought and paid for, it's all corporate, we understand that relationship really well, and let's go organize to do something different, because what this really feeds on is people's sense of disempowerment and cynicism. And I hear this from 18-year-olds, which is incredibly distressing. So that's really our task, is how to make that case and then say, and here's how you can change the world by doing this other thing.
No, I know. It is very disempowering to dwell on the negativity. I think that the message is, well, money in politics is the reason why we're not getting a government that works for us, and the antidote to that is people in politics, which is join us, get active. It does. Voting is the the minimum you can do in a democracy, not the the maximum. So I get your point. We have to. Our messaging has to be realistic, but not disempowering. I think that's the challenge as an activist.
Sid?
Sid Sokolar. I think Chris put his finger on a very important proposition. And I don't think he put it in these terms, but let me rephrase it and see if he likes the way I do that. One of the big problems in our efforts to get a single payer system, to get any decent healthcare reform, is the absence of social solidarity in the country. Now, healthcare is not the only issue on which that manifests itself. And I'm wondering if you think that the single-payer movement, or broadly the healthcare reform movement, isolates itself too much from other social justice movements that could collectively build a greater sense of social solidarity through their small and big victories and through their struggles. I'm thinking of jobs for all, living wage, decent affordable housing, you name them. Why should we be struggling off on our lonesome around one issue that is so important to people when there's so many others too? And have we been giving enough thought to ways of building bridges to these other movements? Now, one other thought. I worry if we start talking and thinking in ways that suggest that things are getting bad, and if they get bad enough, then people will wise up and do the right thing. That's not anything we can count on, because things can get worse and worse and worse. And nothing will happen unless other things intervene.